Today, we're diving into a crucial yet often misunderstood topic in the medical world: neutropenia. But what exactly is neutropenia? At its core, neutropenia is a condition characterized by an abnormally low count of neutrophils, which are a type of white blood cell essential for our body's defense against infections. Neutrophils are a key component of the immune system, specifically targeting bacteria and fungi. Under normal circumstances, an adult's neutrophil count ranges from 1,500 to 8,000 cells per microliter of blood. When this number falls below 1,500, it is classified as neutropenia. Neutropenia can be classified into three categories: mild, moderate, and severe. Mild neutropenia occurs when neutrophil counts are between 1,000 and 1,500 cells per microliter. Moderate neutropenia is when the count drops below 1,000 but remains above 500, while severe neutropenia refers to a count of less than 500. Each level indicates different risks for infections and may require varying degrees of medical intervention. Now, let's explore the causes of neutropenia. There are several factors that can lead to a decreased neutrophil count. One of the most common causes is bone marrow disorders. Since neutrophils are produced in the bone marrow, conditions such as aplastic anemia, leukemia, or myelodysplastic syndromes can severely hinder their production. Medications also play a significant role. Certain drugs, particularly chemotherapy agents used to treat cancer, can lead to neutropenia as they can damage bone marrow. Autoimmune disorders, where the body's immune system mistakenly attacks its own tissues, may also contribute. In some cases, infections such as HIV or sepsis can temporarily reduce neutrophil counts. Symptoms of neutropenia are not always immediately apparent, which is a significant reason why awareness of this condition is vital. Individuals may not experience any noticeable symptoms until they develop an infection. When an infection does occur, it may manifest through fever, chills, or unexplained sores. Due to their weakened immune system, individuals with neutropenia may also find that routine infections, like a cold or the flu, become more severe or frequent. Diagnosis of neutropenia typically begins with a complete blood count, or CBC test, which assesses the levels of various blood cells, including neutrophils. If neutropenia is diagnosed, additional tests may be required to determine the underlying cause. This could include bone marrow biopsies, blood cultures, or tests for autoimmune disorders, depending on the individual's medical history and symptoms. While neutropenia can be concerning, the approach to treatment largely depends on its severity and the underlying cause. For mild cases, close monitoring may be all that is needed, especially if there are no accompanying symptoms. In moderate to severe cases, treatment may involve antibiotics for infection prevention, growth factors to stimulate neutrophil production, or even blood transfusions in extreme instances. For those with drug-induced neutropenia, adjusting or discontinuing the offending medication under medical supervision is typically recommended. Living with neutropenia may also require lifestyle adjustments to reduce the risk of infections. Individuals are often advised to maintain good hygiene practices, avoid crowded places or those who are sick, and handle food safely. Regular follow-ups with healthcare providers are crucial for monitoring neutrophil levels and tailoring treatment approaches as needed. In recent years, advancements in research are paving the way for more targeted therapies to address neutropenia. Clinical trials are exploring new medications to enhance neutrophil production and boost the body's immune response more broadly. In conclusion, neutropenia, while potentially serious, is manageable with proper understanding and care. Early detection, careful monitoring, and tailored treatment plans can significantly improve outcomes for individuals affected by this condition. Awareness is key, not just for those living with neutropenia, but for healthcare providers and loved ones around them. If you found this information helpful, consider sharing this video to spread awareness about neutropenia and its impacts. Thank you for tuning in, and remember, if you have any health concerns, consult a healthcare professional for personalized advice.